And still ahead on Morning Joe, we're going to talk to swing state Democrats Tim Kaine and Michael Bennet about their alternative to the Medicare for All plan that's popular among their Democratic colleagues who may be interested in running for president. Plus,
joining us now, members of the Health, Education, Labor, and Pensions Committee, Democratic Senators Tim Kaine of Virginia and Michael Bennet of Colorado. This week, the two senators introduced legislation that would create a public health care option to go along with the Affordable Care Act. Gentlemen, good morning. I want to talk about that in just a second, but Senator Bennet, let me ask you about health care and this legislation that you have co-sponsored with Senator Kaine, calling for a public option, a term that was very familiar around the Obamacare debate several years back. Why do you think now is the time, and will you have the votes to get that through?
Well, I think I've always believed a public option should have been part of the Affordable Care Act. We tried to get it done then, and we weren't able to do it. Tim and I have both heard from our constituents, especially in rural Colorado and rural Virginia, that it's just unreasonable to force people to buy insurance when there is no competition, price is high, the deductible is high, and that people want to have an option. And so that's what this very strong public option, Medicare X, is all about. We're going to start rolling it out in rural parts of our states, or the proposition is roll it out in rural parts of the states, and then have everybody have access to it in about 3 years. Whether we'll pass it, that is an interesting question, because virtually nothing can pass these days in the Congress. I think that as part of an attempt to actually resolve the issues that people are having, not so much with Obamacare, but with the American healthcare system, this ought to be part of the solution to that, and I am optimistic that we will be able ultimately to get it passed. I'm very pleased to have Tim as our co-sponsor here, because I think that brings a lot of credibility to the bill.
And Senator Kaine, your colleague in the Democratic caucus there, Senator Patty Murray, has been working with Lamar Alexander on a bipartisan health care plan that would stabilize short-term the insurance markets. And we saw what President Trump has had to say about that, several different positions over the last couple of days. And my question for you is whether you think you can trust this president as a deal maker, and what are you hearing from your colleagues in the Senate, including those across the aisle, about his inconsistencies?
Well, there's great inconsistency, but here's what we're trying to do. And Michael's been part of this deal-making effort with Lamar and Patty. We all have been. When the skinny repeal vote failed in July, that effort to take insurance away from 20 million people, we started to work on a bipartisan proposal to stabilize the individual insurance market. We owe it to the American public to show them after 7 years that we can do something in health care on a bipartisan basis. And I'm really gratified that Lamar and Patty have put this deal on the table to stabilize it with the payments that help people afford their co-pays and deductibles, and also giving states flexibility. 6 Republicans have already come out and say that they support this deal. Many Democrats are supporting it, and I think we can get this passed as part of some larger legislation this year. And then we move on to the bigger question of what do we do to fix health care going forward. I think our bill is a solution there. But look, the president's backing and forthing on this, as on so many other things, is sort of making them a little bit irrelevant to the discussions in the Senate. We're moving ahead on trying to find bipartisan solutions, and we're not going to let tweets get in our way.
If I could just add to that, there is nobody in the Senate that I have more confidence in than Lamar Alexander as a legislator. And he and Patty Murray are responding to the testimony we heard on our committee in a bipartisan way that universally called for the things that are in this bill that they've written. So it would be a shame if we didn't use this opportunity to pass this bill, stabilize the markets, and President Trump's attempts to sabotage the Affordable Care Act have been useless to people living in Colorado. This bill would help us.
Well,